Welcome to Stroke Forward. My name is Marcia Moran. For the next 40 minutes or so, we are going to talk about things that stroke survivors or any brain injury survivor deals with. If you look at me today, you probably don't see a person who had a stroke, but I feel it. My body functions differently. Do I think I will get back to 100%? Yes, because to think differently is to admit defeat. We will talk to all sorts of people who have been there, from survivors to caretakers to doctors, nurses, therapists, friends, and family who have seen us at our weakest. They have cheered us with their victories, no matter how large or how small. How did we get here? That's what this show is going to tell you. Jan Jahnel, RN, SCRN. Jan is a retired nurse and stroke coordinator from OSF St. Francis Medical Center in Peoria, Illinois. She was a neuroscience nurse for 25 years at OSF St. Francis Medical Center, with 17 years as a stroke coordinator for the OSF Illinois Neurological Institute Stroke Center at St. Francis Medical Center. She is an RN and a stroke-certified registered nurse. She is currently post-retirement working part-time at the United Stroke Alliance in Peoria, Illinois, which allows her to continue her passion for stroke survivors and caregivers and allows her the opportunity to continue her love for prevention, awareness, and recovery for stroke. She lives in Washington, Illinois with her husband, Scott. She has 3 grown children and 7 grandchildren and loves to spend time with family and friends or fishing with her husband at their Lake Sarah retreat. Thank you for coming, Jan. It's nice to have you here.
You're welcome. Thank you for asking me. I'm very honored.
So my first question is, what made you decide to become a nurse?
Oh, well, it's, I didn't start out wanting to be a nurse. When I was a little kid, I always wanted to be a teacher. And then I went to school for marketing and management, got married, had kids. And my dad came down with head and neck cancer when I was about 30. And so he had a really rough time, lots of surgeries, lots of chemo, lots of radiation, stuff like that. We ended up taking care of him at home. He had a feeding tube because he couldn't eat, and all kinds of stuff going on. And I just all of a sudden felt this calling that I wanted to be an oncology nurse. I wanted to take care of cancer patients and give them love and care when they were going through such a difficult time. So I dropped everything and started back into nursing school and went to school, became a nurse, passed my boards. And then at the time, there was no oncology jobs available. So I ended up being led to a different area. And that's where I became a neuro nurse.
Okay. So is there a difference between a neuro nurse and a nurse? Tell me what the difference is.
No, it's just the specialty that I actually, the floor, the ward, the unit that I was employed to, and it was the neuroscience unit. So that was a unit that took care of patients with head injuries, spinal surgeries, brain problems, all kinds of things like that. So it was basically problems with the brain and spinal cord. So those were the patients that we took care of.
Okay. And then
stroke
is there,
patients.
I'm sorry, what?
Also stroke patients and yeah.
Right. And that leads right into my next question. So is there a difference between a neuro nurse and a stroke certified registered nurse?
The stroke certified registered nurse is a certification that I took a test for, I studied for to be certified in stroke care. I was also a certified neuroscience nurse. So these were just certifications within neuro that I could take to, get more education and more information about the kinds of people that I took care of, and to actually be specialized in it.
Okay. And do you think that this specialization helped you take care of these stroke patients along the way?
I think that it helped me to understand what kind of care should be provided.
Right.
And as far as knowing the guidelines and the routines, and knowing the specialties and the rehabilitation. So I think it did help me. I still think that there's really, really good nurses out there that don't have that specialty. It was just something that I personally and professionally wanted to do.
Right. Okay. So when I had my stroke, I didn't know that I was having it, right? So I went back to sleep. And that was a big problem for me when I woke up and I went, okay, I can't move my right hand side.
Yeah.
So do you find that most stroke survivors do or do not know what's happening to them?
I think it depends on where the stroke is happening, and if you're aware. Right now, only 38% of people know the signs and symptoms of stroke. And so, I'm not sure what your situation was, but in the middle of the night, you wake up, maybe you can't feel one side, you think, oh, I laid on my arm wrong or something, and you go back to sleep, or you just don't realize that that's something that you should take seriously because you're not really aware of what the signs of stroke are. And then again, it could have something to do with the area of the brain where you are able to, process that kind of stuff. And if that stroke was affecting that at that time, it may be something that you didn't see an urgency for.
Okay. So what are the signs of stroke?
The signs of stroke, well, we at the United Stroke Alliance, I'm going to plug that here. We use the acronym Be Faster, and that's what I teach to students and adults as well. And Be Faster is an acronym for all of the signs of stroke. B is for balance. If you have trouble, or you see someone that's having trouble with their balance, leaning to one side, maybe falling down, not being able to stand up, dizzy, that is could be a sign of stroke. E is for eyes. They can have visual disturbances. Some people will say it's like a shade comes down, or they can't see one half of something. Sometimes it's blurry or double. It's very sudden. It just happens, and they're having trouble with their eyes. F is for face. They can have a facial droop, where if they smile, one side of their face is droopy because the stroke is happening and affecting the nerves. They may not be able to feel one side of their face. A is for arms. We always, if we think someone's having a stroke, ask them to raise their arms up in the air with their palms up like they're catching raindrops. If one side drifts down or their hand turns in, there's any weakness on one side, that is a sign of stroke. S is for speech. Speech, we not only speak language, but we also understand it. So people can have trouble speaking, getting the right words to come out. Their speech may be slurred, it may be garbled. Also, they can have trouble understanding speech. So we just don't speak it, but we understand it. So if you're asking them questions or trying to talk to them and they're looking at you like they're confused, or they're scared, or they don't understand what you're saying, it's probably because that part of their brain where they receive and understand speech is being altered. And then ER is emergency response. And we tell everybody, please, 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 at the first sign of stroke, call 911. A lot of people think that they can just drive to the hospital or take themselves to the hospital. But we know that immediate and urgent response to stroke by calling 911 is the fastest way to treatment. Even if you live close, we know that getting there by ambulance, there's a lot of things that the EMS is trained to do prior to you getting to the hospital, which speeds up the ability for hospitals to treat you quicker. They can get a blood sugar, they can get blood pressure, they can do some things, start oxygen if they need to. The biggest thing that they do that helps stroke centers is the pre-notification. And they have a way to pre-notify the hospital that says, hey, we're coming in with a potential stroke patient. And they use the same acronyms, be fast, faster, whatever. We have a positive, be faster person coming in. And so the hospital can get everything ready to go. We can, where I used to work, we had a stroke team, we had an emergency page. We knew that person was coming in, and we could be in the ER to meet them with the CT scanner ready to go. Wow. So emergency response and calling 911 is really the best way. And we know from our data that our times were so much better, so much faster if they came in through the EMS system. So be faster for stroke.
Okay.
All right.
Remember that. So how long does a stroke actually last? Do you know?
Well, until the area of the brain that is being cut off from blood supply is either severely damaged or is dead. So it's hard to say. We know that every minute about 2 million brain cells are dying.
Right.
So the sooner treatment can begin, or we can, restore that blood flow, the better chance they have of recovering more from that stroke. But if they don't get there in time, or they're not a candidate for the treatments, it's basically just usually about 24 hours, I would say, is what we usually say.
Right. So you said if they get there for treatment. So what kind of treatment are you talking about?
There is a medication called alteplase activase. We call it TPA. Some people may have heard of it as TPA. It is a clot busting drug for the ischemic type stroke, which is the most common type of stroke that people have. And that's where a clot forms in a blood vessel and blocks off blood flow. So the TPA is an IV infusion. It has to be given within so many minutes or hours of the stroke symptoms starting. Mm-hmm. But it's an IV infusion over an hour, and it helps to dissolve the blood clot. Okay. Sometimes that works really well, and it dissolves it if the clot is big enough or in an area where we say a neurointerventional surgeon. This is like they do for the heart, where they do the cath and go up and pull the clot out of the heart. Well, we can actually, I'm retired, I don't do anything anymore, but the physicians can go up and take a catheter and snag that clot or try to dissolve it up there and restore the blood flow. Again, that has to be done within so many hours of symptom onset. So that's why learning the signs and symptoms of stroke and that emergency response is so important, right? Because even the treatments are time dependent.
Right. Okay. So what do you think is the hardest part for a stroke patient to deal with?
Oh, there's so many things. The first thing that comes to my mind is the fact that they don't completely understand what's going on. Right. So, and many times, we're so busy taking care of them and doing things, we don't get a chance to explain things until later. I think too that a lot of people think, oh, well, this too shall pass. I had a heart attack, I'll get better, I'll take therapy. And they feel like, in 3 to 4 weeks, I'll be back to my normal self. And that doesn't always happen.
Right.
And I think too that loss of independence and that loss of the ability to do things for themselves is probably one of the hardest things for them. Right. Because they're relying on someone else to do what when they woke up this morning, they could do by themselves.
Right. I actually can agree with everything you said.
I'm sure.
So, yeah. So tell me one thing that made you really smile when a stroke survivor did it.
Oh my gosh. There's so many. I've been involved, with them for, well, 18 years as the stroke coordinator. And then I've been doing the stroke camps, which I'm sure we'll talk about a little later. But um, just seeing them do something for the first time, that first time that they're able to get the right word to come out or to move their arm, just that sense of accomplishment for them is just makes me smile. They make me smile every day just because they're so resilient, they're so strong, they're so determined. And once you see them actually accomplish something, it's just like their whole world opens up, like maybe there is hope, there's possibility, I got to keep trying.
Right.
So that makes me smile. There was I'll tell a story if it's okay,
Of course.
of a stroke survivor. It was an African-American gentleman, and he was a police officer and had his stroke while he was on duty. So no one found him in time. He didn't get treatment.
Oh,
He could move and walk, but his speech was very altered. The only thing that he could say was bam, bam. That is all that would come out. But he always smiled. He always had just a he would participate with us, bam, 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 and just the tone of his voice. And he tried so hard, and um, he was never without a smile and wanting to, interact with people. And he worked very hard trying to get his speech back, but he, had a hard time. One day at camp, he had gone to, and I think it was an aphasia program or something. And he came to camp, and his sister, who was his caregiver, said that he had something he wanted to tell us. So we're all sitting there thinking, okay, we're gonna, he's gonna bam, bam, and we're gonna try to figure it out. And he started tapping his leg, and he said, "I am Sam. I am happy." And it was the most amazing thing. This big, huge smile came across his face, and his sister was in tears. I was in tears. The whole group was in tears because that was such an accomplishment for him, and he was so happy. And those kind of things just make me smile every day.
that's awesome. Yeah. I wish I'd been there.
It was so neat. It's something I will never forget.
Yeah. So, what advice would you give the caretakers then?
Oh man, they've got a rough job. I think the first thing is patience.
Yeah.
That your survivor has to learn these things all over again. We have to have the patience that we had when we were teaching our children. We have to know that it's going to maybe come with time. They're going to learn it. It's going to take some bumps and bruises and some falls, and us keeping, working with them. But it's just patience. Because if they're not patient, then their survivor gets discouraged, and that's just never good. So if you can have patience, that's probably the first thing I would say. Strive for that patience. And then acceptance. It's very hard to accept that your loved one is now maybe a different person. They can't do certain things themselves, or they can't communicate with you the way they used to. So you have to accept that life is now going to be different for them and for you, and to really strive to find that new normal. What's going to be that new normal for you and your loved one? And then the other thing that I would really strongly say is to take care of yourself. Find support, find encouragement, find what you need. Take good care of yourself, get sleep. If you need help, find that, because you can't take care of them if you're not healthy yourself. Yeah. So, take time for yourself and take care of yourself.
Yeah, good advice. Good advice. So how long does it take a stroke survivor to get better?
I would say a lifetime.
Good
Because
answer.
I've seen that story that I just told you. That was 8 years after his stroke that he was able to speak.
Mhm.
There's, the brain is very slow to heal, and it is one of those organs that when it can't do something, if you keep trying to do it, it will try to find a new way to do it. It might not be the same way that you did it before, but it is going to keep working. So I always encourage people to never give up. And I hate it when they say, oh, well, they said if I didn't get it back in 3 months, like, I wouldn't have it back. I cringe when I hear that, because I've seen stroke survivors keep working and keep striving and never giving up, and being able to have those moments where I said a word for the first time. I didn't speak an entire sentence, but I said a word. I moved my fingers. Just the little victories, and you have to celebrate those little victories every day.
Right, right.
So I would say a lifetime. You just have to keep trying and never give up.
That's also good advice. So it sounds like you were talking about neuroplasticity there.
Mm-hmm.
So do you want to go into just a little bit about neuroplasticity?
Yeah, neuroplasticity is the ability for uh, an organ to, especially the brain, to find new ways to do things. It can, maybe this area of your brain isn't working, but if you keep trying and keep sending those signals to your brain, then maybe this area of your brain can't pick it up, but this area might be able to. And I kind of equate it with a traffic jam. The road's closed right here. And so I got to find a way to go around this blockage and get to where I need to be. And that's kind of what I think neuroplasticity is it's a constant repetition and moving around in the brain to try to find another area that can help you do what you're trying to do. And again, you're probably not going to be able to do it as fast as you did it before, because if we have a roadblock and a detour, it's not going to be the normal way that we do it or as fast as we do it, or are, usually how we go, but we may be able to get there.
Right.
And so that to me is what neuroplasticity is. It's just that roadblock, and then the brain trying to find a new way around to get you where you want to go.
Yeah, so I think I'm going to steal that from you, if I could.
You go ahead. That was just how I would try to explain it to people in my simple little mind.
Okay. So what is it like being the stroke survivor from OSF, St. Francis Medical Center?
Um, Well, I had an amazing career as a neuroscience nurse. And then, like I said, 17 years as the stroke coordinator for OSF. We had a wonderful program that was built, from the ground up. Dr. David Wong was the stroke neurologist that was there when I took the position in 2004. And we had been the first center in Illinois to be certified by the Joint Commission as a primary stroke center, which meant that we had resources in place and things that we could take care of stroke patients. And so with Dr. Wong and administration and help from the hospital and other physicians, we were able to build a very strong stroke treatment center. We had hospitals from different areas, about 20 hospitals, 25 hospitals from different areas that would send patients to us for stroke treatment.
Mm-hmm.
When the comprehensive stroke center designation came out, we were the first the second, I'm sorry, Stanford was the first by one day. We were the second center in the nation to be
Wow.
a certified comprehensive stroke center. And so it was an amazing career for me. I got to be on the cutting edge of new technology. I got to be in a center where they supported and helped us to grow and to be one of the leading stroke centers in the nation.
Wow.
So it was awesome. And I got to meet so many people, do so many amazing things. That's where I found out about stroke camp and got involved in that. And so OSF Healthcare, they were very instrumental in being a very big advocate for what Dr. Wong and the team was trying to do. So it was awesome.
That's awesome. So you mentioned stroke camp a couple times. So let's get into it.
Okay.
So when did you get involved in stroke camp?
Oh my gosh! In the very beginning, Mary Lee came to. She called and said, "I have this idea, and I want to run it past you."
Right.
And so we met with her. I think it was 2004, maybe.
Right.
And she told us of this idea. She had been involved with camps for kids with cystic fibrosis. She needed support. She needed encouragement. John needed it. And she had this idea for this camp for survivors and caregivers. And she said, I know exactly what I want to do, how I want to do it, but I'm not good at getting monetary support, and I can't do it alone. I need volunteers.
Right.
So we both looked at her, and Dr. Wong said, I will find you the money and Jan will volunteer. And so that was how I got voluntold to go to the first stroke camp. And I laugh about that because I can remember thinking as I drove to stroke camp, oh my gosh, I got so many things to do. But when I got there, it was the most amazing thing. So it was the brainchild of Mary Lee Nunley because she needed support for herself and for her husband, John, who had had a stroke. And she wanted to give respite to the caregivers and a way to interact and find support and encouragement for not only herself, but for John. And so she came up with this weekend camp that focused on socialization, relaxation, support, and recovery for stroke. And so we went to the first camp. It was an amazing weekend. Everybody got so much from it. They walked away feeling like they were not alone, that they had someone that knew what they were going through. The caregivers had a moment to relax. And we actually had some caregivers that actually let go and let us as volunteers kind of take care of the survivor. And they got to have a weekend where they could read or sit underneath a tree and just enjoy the beauty around them. And so it grew. People found out about it, and we started having people from all different states wanting to come to Peoria to camp. And I remember picking up an 80-year-old couple at the airport to come to a camp in Peoria. And that's when they decided that we needed to figure out, or the camp, we need to figure out how to get it to the states instead of the people coming to us. And so it is a weekend-long camp for stroke survivors and caregivers that focuses on like all of those things: socialization. We have support. We have fun. This year, our theme is the Roaring 20s, and so we're going to have all kinds of fun things with that. We have breakout sessions. We have crafts, activities. We have things that people can do that maybe they've never done, like go fishing with adaptive equipment or rock climbing. Some places have swimming. So it's just a weekend to get away and to be with others that are going through the same things that you are. And as a volunteer, I learned so much that helped me in my career. as well as just what caregivers and survivors go through.
Okay. So I know that COVID put a stop to a lot of things. So where do you think we're going to be this year?
Well, we're very optimistic. In 2020, 2020, we did not have any camps because that was really the beginning of the pandemic. And so we didn't hold any camps. And I say we because I'm now, as a retired nurse, am working at the stroke camp office. And so in 21, which was last year, we held 10 camps. And we were very fortunate. We were able to, follow the guidelines, keep everyone safe. We had no outbreaks after holding 10 camps. And so this year we're very excited and hoping to do between 15 and 20. The most we've ever done is 29 camps, I think, in 23 different states.
Wow, that's a lot.
Yeah, so we're really hoping this year, that we'll be able to do those camps, because so many people have said, I can't wait until you can do stroke camp again. I've missed it so much. And
Right.
And even the volunteers, are we going to have camp this year? We're going to have camp this year. So we're
do you have,
excited.
sorry. So do you have people that go from camp to camp?
Some people do. We do have some people that'll go to, more than one camp. But most of the time they end up going to a camp that's near their home, where they can meet people that are maybe in their same support group or in their same community, so that, they have that local support.
Right. Okay, that makes sense to me. So what is your favorite activity at the stroke camp? And you can do that for stroke survivors, caretakers, or people who volunteer, or all three.
Oh my gosh, there's so many things I love. The Saturday morning pampering is one of my favorite things, because we do manicures, and we've done a paraffin hand dips, and we do fishing, swimming, all kinds of activities. So people just get to go, and they have the whole morning to just do whatever we want. We have a massage therapist comes in that gives people massages, and it's just so nice to watch everybody just get pampered and do things that they might not get to do every day. So that's one of my favorite things. And as a volunteer, we get to help with all of those things, and get them places. And then I think maybe the support groups. We have a support group for caregivers, and then support groups for survivors. And being able to sit in those groups and just hear, what's going on with them, what they're struggling with, what they're excited about, so that they can share that with us and with other people. The meals are usually pretty good. We always have really good food. And then I think just at the end of the camp, just seeing everybody just hug each other and finding and connecting, and just leaving with so much enthusiasm and support and hope.
Yeah, it seems like hope is something that you thrive on.
Yeah.
Yeah. Okay.
Yeah. Because it's so needed, and it's so, it's just something that we all are looking for, not
Right.
whether you've had a stroke or not,
Right. Right. Okay. So if there was one thing that you would want to leave stroke survivors with, or their caregivers, what would it be?
Never give up. Don't get discouraged. You've got to keep trying. You've got to, again, keep trying, try to find that new normal, embrace your new normal, and find things that make you happy and things that you can do, and don't ever give up.
Okay. And how do people get in touch with you?
Oh, you can get in touch with me through the United Stroke Alliance. I have an email. It's jan@unitedstrokealliance.org. Or their phone number is 309-688-5450. I guess I should look that up. Or you can call my cell phone. I don't care. At 309-370-8792.
Okay. So I would like to thank you very much for joining me today, Jan. It's been a
Oh, I
pleasure.
can't tell you how much I've enjoyed it, and I hope that I'm very passionate. I hope that came through. I'm pretty sure it probably did, but I'm just so honored that you asked me. Thank you so much.
Thank you.
Join us next time as Abby Simon talks about her business as a certified coach. Specifically, she helps the caregivers navigate their way around taking care of someone while also taking care of the ones they love. I found it a fascinating discussion about how Abby works with the caregiver while I work with the ones affected by stroke and TBI. See you then.